Hi, I'm Susan Taylor with Scripps Health in San Diego, California. According to the Centers for Disease Control and Prevention, 42% of adults and almost 20% of kids ages 2 to 19 are obese. That is close to 115 million people, putting their health at risk. How do you lose weight with medication and/or bariatric surgery? Joining us to talk about this is Dr. Jennie Luna. She's an endocrinologist with the Scripps Clinic Medical Group in San Diego, California, and Dr. Mark Takata, a bariatric surgeon with the Scripps Clinic Medical Group in La Jolla, California. Thank you both for being with us.
Thanks for having us.
Thank you.
So let's start with the basics. How overweight do you have to be considered obese?
Yes, so obesity is defined by the body mass index, or we also call it the BMI. If an individual has a BMI above 30, that classifies them to actually have obesity. However, the BMI is not a perfect measure because it doesn't take into account the patient's muscle mass and fat distribution, but it's still a useful tool.
And Dr. Takata, why are so many folks obese in the US?
Well, there's many components to this. People are certainly eating more and more processed foods. Activity levels are in many cases lower. People often lead a more sedentary lifestyle than they used to. But there's also genetic components and environmental and just innate components to each individual that can predispose them to chronic disease.
Those are great points. In addition, there's a lot of social economic issues and lack of access to healthy foods as well.
And this puts you at risk for what?
So obesity is actually linked to several conditions such as type 2 diabetes, heart disease, certain cancers. So this is why it's so important to help patients that are struggling with obesity to avoid these chronic conditions.
A lot of folks try diet and exercise, but it doesn't necessarily produce the results that they want. Why is that?
Yes, because there are all of these different non-modifiable factors that patients struggle with, such as genetics, age, having a slow metabolism, hormonal issues. So that's why it's so important when we're helping our patients that are struggling with obesity to look at them holistically and see what other factors could be influencing their weight.
So let's talk about medication to help you lose weight. There is medication for diabetes that has a side benefit in that it helps with weight loss.
Yes, so they actually have gained a lot of popularity just recently, but they've been around for quite some time. And the class of this medication is called GLP-1. So they help to actually stabilize blood sugar, but they also help reduce appetite, which is why they can help with weight loss as well.
And does it speed up your metabolism?
Not necessarily. It's more that they create kind of a caloric deficit, or meaning if the patient is eating less, now their calorie intake is less, and the body then now starts to favor the energy that's reserved inside those little fat cells. And that's how the patient is able to shed weight or lose weight.
How fast can you lose weight on these medications?
That's a good question. So it varies with patients. The goal is about 1 to 2 pounds per week. But every patient's different. Some of these medications can help patients lose about 15% of their body weight. So for example, if we have a patient that weighs 200 pounds and they lose 15% of their body weight, they'll lose about 30 pounds, dropping them to 170 pounds.
And are there side effects to these medications?
Yes, there are. Nausea is the most common. Constipation can happen as well, which is why it's so important for patients to stay well hydrated while they're on the medication. Diarrhea can happen as well. So we'd like to increase the medication slowly. That way their body gets used to it.
And is this something that you take for the rest of your life?
I hear this often in practice as well. So because we treat our patients that are struggling with weight, just like we do any other condition, these medications are for long-term, but that is modified on a case-to-case basis.
And what happens if you stop taking the medication? Does the weight come back?
So all those non-modifiable factors we had discussed, for instance, genetics, age, having issues with hormones as well. So most of our patients are doing everything correctly. They have great lifestyles, they're exercising, they're eating healthy, but they're unable to lose weight because of those non-modifiable factors. So that's where these medications can help, not only help them lose weight, but actually maintain the weight off.
Is there anyone who should not be taking this medication?
People that have history or family history of medullary thyroid cancer shouldn't take this medication. In addition, women that are pregnant or are breastfeeding.
So now let's talk about surgery. What is bariatric surgery, Dr. Takata?
Bariatric surgery has been around for a long time. It's an operation done with minimally invasive techniques to decrease the size of the stomach, to decrease the amount that people eat, but it also has other effects on the body that decrease appetite, help with chronic diseases like type 2 diabetes and the other diseases associated with obesity.
And what's the downtime and the recovery time for this surgery?
In general, it takes about 3 to 6 weeks to fully recover from these operations. It varies between operations and individuals, but people should plan to take some weeks off from work and from regular activity just to get their body back into shape.
So what's the success rate of this surgery, and how much weight can you lose?
Well, over 90% of people will lose more weight with this operation or these operations than if they had not done the operation at all. People should expect to lose between 50 and 100 pounds, sometimes over 100 pounds, depending on how much weight they need to lose and what weight they are starting at.
And is there anybody who is not a candidate for this surgery?
Well, patients undergo some visits and meetings with us, as well as some medical doctors to see if they're a candidate for the operation. Most patients get through this without any problem. If we find any red flags, then we try to address that.
And what would those red flags be?
Significant cardiac disease, heart disease, or significant lung disease.
So if you are obese, how do you decide between trying the weight loss medication versus the surgery?
Well, I think it's much better to be proactive with one of these options as opposed to doing nothing. There's lots of excitement about both of these options. From a surgical standpoint, we see a lot of excitement about combining the two treatments together to try to get the best result possible.
Yes, I agree with Dr. Takata. It's nice now to have that synergy where we have these options. Sometimes patients would benefit from the medications before surgery to get them down to a healthier weight before the surgery to decrease complications, which is great. And then some patients that have surgery and might need to lose a few pounds after to get to their goal. So there is a lot of synergy, and it's great that we have different options for patients.
If you don't get a handle on your weight, what can happen?
Well, it's best to try to get a handle on it early. Ideally, patients will attempt weight loss treatment before it gets out of hand. Getting out of hand, however, means many years of sustained weight problems that lead to chronic diseases like high blood pressure, diabetes, and over the long term, these cause medical complications for the patient.
Yes, it increases the chances of chronic diseases. So if we don't address obesity, now this person is at risk for type 2 diabetes, for heart disease, stroke, and certain cancers as well. So the more proactive we are, the better for the patient. And it's great that we have all these different options to help them.
Any final thoughts?
I think the final thought is that this is a hopeful time for patients who suffer with obesity and the diseases that go along with it. Over time, there become more and more options to help patients get treatment, and depending on the severity of the problem, surgery and or medical therapy can be very successful.
Yes, and it's a very empowering time to be able to help patients as providers as well. And it's never too late to make positive changes in your health.
Thank you both for being with us. We appreciate you taking the time.
Thank you for having us.
Thank you very much.
If you'd like more information on how to manage your weight through medication and or surgery, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.